The first threat to Medicare is, as Canadian, we've been lucky to have a public health care system, and we take it for granted. And the second threat is the whole privatization agenda. There are some groups and regroupments of Canadians that believe if I can afford more or if I can afford to jump the queue, I should be able to pay for it, not realizing the impact it has on the whole system for all Canadians. Our system is based on needs, and it's not based on the aspect that you can pay more and get faster service.
Why is queue jumping such a threat? What is the impact of queue jumping in private clinics?
Right now, queue jumping is a threat because the way our system works is a physician will decide what is medically necessary for you and the urgency. They will place you based on your medical evidence, place you on the queue, if you can call it. But if it's your credit card or the fact that you can pay faster puts you ahead of somebody who's sicker, it goes against all the values of our healthcare system.
Isn't it a good thing for people to be able to purchase the health care services they need?
But what happens to the one that medically really needs it now? You're going to be placed ahead of them because you can pay more money. That is not the way our system is based. Our system is based on treating everyone equally and treating everyone that is medically necessary needs care.
Yesterday on the panel, you talked about the need for public education. You have emphasized it over and over again, the need to educate the public about Medicare. Tell me what you mean by that and what do you think that education should look like?
But public education is all about understanding our system. Understanding our system is there when we need it. We've been abusing it. We've let go the whole health promotion, health prevention aspect. We don't have an appropriate home care program. We don't have a pharmacare program. And we're the type of society, if we have a common cold, we go knocking at the emergency room. One, because we don't have clinics, we don't have nurse practitioners, family physicians that are there to help us deal with the day-to-day. So when we talk about public education, is understanding our system is there for those who need it. And those of us who are healthy, we need to keep working on being healthy and doing that through clinics, through different groups, not the emergency rooms. Realizing that the acute care sector, the hospital, is the most expensive. So let's leave it for the sick and have another system talking about health promotion and prevention.
What kind of public education is your federation doing and your allies as well? What kind of public education efforts are you involved in?
Okay. First, we represent nurses across the country, 158,000 nurses and nursing students. So it's giving them the ammunition on what are the real costs of healthcare, what are the impact of the shortage of nurses, of doctors, and other healthcare professionals, and encouraging them to talk to their neighbors. Nurses protect our healthcare system, and we want to see it enhanced. So we need to build better coalition, better regroupments with all our friends and families to make sure that our system will be there for my grandchildren.
Which is what the Health Coalition is about, I guess. You showed us a book yesterday called Champions of Medicare. Could you hold that up, please, for the camera?
Yes, Champions of Medicare was printed 2 years ago. We wanted to know, and we did interviews with 10 different champions, from Kathleen Connors, an RN, a retired RN, chair of the Canadian Health Coalition for 20-some years. Why did you spend your career, and still doing it, defending our public health care system? We interviewed Roy Romano. Why did you spend your career defending our public health care system? L'Honorable Monique Bégin, who created the Canada Health Act, why still today in her 70s she defends and wants to see our healthcare system enhanced. So these type of people were there 40 years ago trying to build our system, and they're still there today. And it's one tool of public education. We also do other on the web, our website, of course, other pamphlets on the values of healthy living, the values of a pharmacare program in our country, of a home care, mental health, and of course Aboriginal health is one of our priorities.
You talked yesterday in the panel as well about the comparison between spending on drugs and spending on healthcare professionals. Can you elaborate on that a bit, please?
Yes. We have to realize that in Canada we spend more on prescription drugs than we do on doctors. And we know we have a shortage of doctors. We don't have a shortage of drugs. We have a shortage of doctors. So when you look at the healthcare spending, there's about 17% of it that is only for prescription drugs. And that is the healthcare spending that goes faster than anything else, than human resources, than buildings, than capita, equipment. It's drugs. We need to take a grasp at that and develop a national pharmacare program so everyone would be treated equally. But it would also give the powers to government to buy in bulk, so they would buy cheaper. It will also give the powers to government to provide safer drugs to Canada, because they would be able to analyze the impact and the outcomes on patients.
And are you campaigning then for a national pharmacare program? Have you been involved with the members of parliament on the Hill?
Yes, in 2004 we dealt with the premiers at the Council of Federation, and we were very lucky. The premiers were agreeing we need to do something about the cost of drugs and we should look into a national pharmacare program. It hasn't moved much since, but it's a continuous, we present to the Standing Committee on Finance, on Health, and the premiers that we need to continue lobbying and finding the real costing of a national pharmacare program and the impact on Canadians, of course.
Have you been talking to Canadians themselves about a pharmacare program? What kind of response are you getting?
We're getting a very positive response. On the panel yesterday, we had a young family that has to pay for the drugs of their 2 sick children because insurance only pays so much. And if it's not charities of other organizations, they wouldn't be able to afford these drugs. So that's not the way our country, our system works. And when we talk about prescription drug, it is part of your treatment. We're not talking about cosmetics here. We're talking about what a physician or a nurse practitioner prescribed to you to get you better. You need it for getting better. It's just like a physician, a surgeon will prescribe a surgery. That will be paid in Canada. But the drugs, the treatment won't be paid. And that's where we have to work.